Great. Thank you for joining our call. My name is Reagan Dean, and I am a National Marketing Director with the Juice Plus Company. Our mission is to inspire healthy living around the world, and I am so grateful to have so many medical professionals who help us do just that. Juice Plus is the most medically researched nutritional product in the world, and we've got over 30 published research articles now, and more coming. And Juice Plus is available in over 20 countries. We are also proud to offer several programs that serve families to flood their bodies with produce globally, which is just really awesome. Tonight we have 6 different practitioners from all different areas who are so gracious to share with us why they recommend Juice Plus, what the benefits that they've seen, in their own health, as well as those that have followed their advice. And first up, we have Dr. Carole Christensen, who is an OBGYN, and she is practicing out of Grand Junction, Colorado.
Hi, everybody. So yes, I'm an OBGYN. I was in private practice in Boulder County for 30 years and moved over to Grand Junction 3 years ago to be an OB hospitalist. And I started sharing Juice Plus with my patients about 10 years ago. I had been taking it for about 6 months and just saw what it was doing for myself and my family and just thought, wow, patients need to hear about this. I had also looked at the research in the meantime and was very impressed. At that time, there were only 9 studies on Juice Plus, and now there's 37. So there's just more and more, and I just feel obligated to share with patients. They deserve to know that they can take control of their health and how they feel. I just wish they could understand that. But I just think that patients are so much sicker today than they were when I graduated from medical school many years ago. And it just really makes me sad because there's no doubt in my mind that it's related to their diet and lifestyle. So, I shared it with, initially I started out very slowly sharing it with patients, and the more I took it, the more I learned about it. I became less and less shy about that, and very few patients left my office without me asking them what they knew about Juice Plus. And, some of them were interested and some weren't, and that was fine. And, but those that did take my advice. I mean, I guess the thing that I heard more than anything was just patients just felt better. They had more energy. They looked better. They would have comments on how great they looked. I had a lot of pregnant patients take it, and their babies. I mean, you could just tell they were Juice Plus babies when they came out. They just had a different glow about them. They held their head up better. It was really amazing. But I guess the one thing that one patient, she'd been my patient for many, many years. And one year she came in and she just says, you've been my doctor for a long time, and the best thing you ever did for me was tell me about Juice Plus. So it's those kind of comments that just keep you going, and you just got to keep spreading the word. I mean, for myself and my family, again, I just think I've been taking it so long now, I don't remember what I felt like beforehand, but I do get comments a lot that I look younger than I am. So that's always good. That's a good thing. And I just think I have less joint aches and pains. I know my husband's gut works way better than it did before he was taking Juice Plus. My daughter got off her asthma medication. So just my own family, we've had a great experience with it. And I'm certainly going to continue it. Business-wise, I really just started sharing it with patients because I thought that they deserved to know about it. I really didn't think anything about, well, you'd make some money doing it. But the more and more patients I shared it with, the paycheck just starts to grow after a while. And then, it gets to a certain level and you go, wow, this really could turn into something, and which gets you more excited about the business in and of itself. And it took me a long time to get to that point, but it really is an awesome business model, and it definitely is helping to supplement my income. And I can see that it will be great when I do decide to completely retire, that it's going to be a nice extra chunk of change to do those things that I want to do when I retire. So I'm going to turn it over to Donna, who is a nurse, been an oncology nurse for the last 10 years, and I'll let her take it away.
Thanks, Carole. So first of all, I just want to thank Reagan for giving me the opportunity to share some information here tonight. So yes, I am an RN. I've actually been retired from nursing for 10 years, but I worked at the same hospital for 33 years in Minnesota, and I worked a lot of different areas. I worked at medical station, I worked med-surg, I worked orthopedics, and then I went to same-day surgery, and then the last 8 years I actually worked oncology. So my husband and I were introduced to Juice Plus about 7 years ago, and it was mainly because of his diabetes. And so it made sense to me. It was just fruits and vegetables, and I knew that we probably weren't getting enough, and so we said yes for him. But I did not say yes to Juice Plus right away. I really felt like at that time, being healthy to me was maintaining my weight. And so I didn't really feel like I needed it. But my husband, or after a little while after my husband was taking it, I got a little curious about what it was, and I started kind of reading up on it. And when I came across the research on Juice Plus, that caught my attention because it's gold standard studies, it's peer reviewed, it's published in medical journals, and it's the type of thing that gives the product a lot of credibility. So I knew that my diet was far from perfect, and I thought, well, maybe I should give this a try. So I started it with really no expectations of seeing any results. But I noticed a lot of things. But the 4 things that I think that really stand out for me is initially, really almost right away, I noticed that my hair was growing faster and my nails were growing faster. And so I knew that that was a sign of good nutrition. So I found that kind of interesting. And then the next thing that happened, I had suffered from hay fever and sinus infections for years. And I started taking Juice Plus in February, and it was that following fall that all of a sudden I was aware that I didn't really have hay fever. And generally what happened for me is the hay fever, started the inflammation process that led to a sinus infection, to antibiotics, a lot of times a Medrol dose pack, to get the inflammation down. And I can honestly say I've never had a sinus infection since I started taking Juice Plus. So for 7 years. Then the next thing that I noticed was I had a car accident when I was in my 20s and changed the curvature of my cervical spine. And so I was having some arthritis issues when I started getting into my 40s and a lot of pain. I saw an orthopedic surgeon who said, there's really nothing we can do for you. Take Advil. And he suggested four times a day, which was a lot of Advil. And so, but I was taking it because I was in a lot of pain. After I was taking Juice Plus for probably a year, I realized I wasn't taking Advil anymore. And then shortly after that, I ended up in the ER one night with a really rapid heartbeat. And after some tests were done, they realized I was taking thyroid medicine that I didn't need to be taking anymore. And so it was a few months later, I saw a chiropractor for low back pain. And he said, did anybody ever connect the dots for you between your neck pain and your thyroid? And I said, no. As a matter of fact, I asked my primary doctor, does changing your nutrition have anything to do with your thyroid? And he said, no. Well, this doctor was familiar with Juice Plus. And so he explained to me that the same nerves that were causing my neck pain were the nerves that go to my thyroid. So he really believed that taking Juice Plus and reducing that inflammation was really what benefited me. So I just found that very interesting. So I started sharing Juice Plus with people, and I have a nurse friend, Patsy, who was diagnosed with primary biliary cirrhosis years before. But a friend of mine that was also doing Juice Plus had shared with me that she had primary biliary cirrhosis, was doctoring at the Mayo Clinic, and after she had started taking Juice Plus, they noticed that her her liver enzymes were getting better. So they actually asked her if she was doubling up on her medicine. And she said, no, I started taking Juice Plus. That's the only thing different. And they said, well, whatever you're doing, keep doing it. So I shared it with my friend Patsy, and she said, sure, I'll try it. She also doctored at the Mayo Clinic in Minnesota. And she by now had an enlarged liver, and her liver enzymes were elevated. And 7 years later now, her liver is back down to a normal size, and all of her liver enzymes are normal. So it was really great to be a part of that for her. So I really share Juice Plus with people for a lot of reasons, but the two main reasons is that we have studies that show that it reduces inflammation, which I saw in myself, and also it reduces oxidative stress, the two things that are really underlying causes of everything that can go wrong with us. We actually have one study that shows that in 28 days, there's 75% reduction in free radicals. So that's huge in speaking about disease and also anti-aging. And I don't know about you guys, but I just had a birthday yesterday, and I'm totally into anti-aging. So as far as the business goes, like I said, I've been retired for 10 years. So Juice Plus has really just offered me a way to supplement my my retirement very nicely. So I am going to turn this over now to Jennifer Rankin, who is a dentist.
All right, thanks, Donna. And I really am just so honored to be able to be on tonight's call and to share my personal story as well as my business story. So I've been with Juice Plus. I started Juice Plus about 12 years ago, and it made sense to me right away because it's food. But I was initially a little skeptical. Not skeptical. I think I just was a little nervous about sharing with other people. So I kind of started that a little bit slow. But what I noticed was with my family, both myself especially, and then especially my son, is that I felt like my immune system just really got better. All of a sudden, I just was not getting that yearly cold that would happen right around the fall season. It always seemed to happen right around Thanksgiving and the holidays, and I would just get run down, and it just sort of slowly went away. And I felt like my workout recoveries were better. And then with my son, he would pretty much, anytime he got a cold, if he had that cold for more than about 4 days, I knew we were going to be calling the doctor, going in and getting an antibiotic for an ear infection. And this was even after he'd had tubes. So all of a sudden I just noticed over time that his body was just able to fight it on its own, and it recovered much better. And, we wouldn't be in there getting that antibiotic. So, those are huge things, because I really didn't like to have to give him the medication, but you have to do what you have to do when they get that sick. And another thing that happened to him, and I truly believe that this is just based on his years of having Juice Plus, but when he was a senior in high school, one of the hockey games, he got hit pretty hard, and he literally looked like a drunk person on the ice. He could not stand up. He fell over. They had to kind of get him off the ice. And, we pulled him obviously for the rest of the game. And the next morning when he got up, he was pretty much normal. And when we took him in for concussion testing, the doctor was like, he did better than most people that haven't even had a hit. So I just truly believe that had something to do with just the years and years of having Juice Plus in his system, because that's the only thing I can relate that to. So, for me, it just made sense. I liked getting that fruit and veggies in my body because I just wasn't getting enough in as hard as I tried. And I also love the fact, again, with the research. I mean, that was a big thing for me. And that gave me confidence to start, when I started seeing results, then to be able to share that with my patients. Just knowing that piece. And the other really cool thing is we have a couple dental studies that are specific to Juice Plus. So it's nice for me to be able to share that with my patients. And I have seen in my practice that the patients that are dealing with bleeding gums, bone loss, things like that, that they're doing better. Their gums look better. The bleeding points go down, and that's all what the research shows as well. And there's also some studies post-surgery. So for any of you who have kids that need to have their third molars taken out, they're finding that you need less pain medication, that there's less soreness, and less the ability for the jaw to open and close is increased with Juice Plus. So, those are just huge benefits. And so I love seeing firsthand what the research is proving. And the other thing is, I don't know how many of you know, but there is a very close connection between the body and what's happening in the mouth. They're not like two separate entities. And I think sometimes there's a disconnect there. And I even see that with patients sometimes when I ask them, what they're doing with their diet or how, what changes they're making there. And they look at me like, well, why are you talking to me about that? And, there are certain bacteria in the mouth that have been linked specifically to causing cardiovascular disease. And the same thing with cardiovascular disease. If you have a weakened immune system, you're going to have a greater chance of developing periodontal disease or gum disease. So they're very closely connected. And if we can have a positive impact on both, then the results that I'm going to see in my dental chair are going to be better. And also when the patients go back and visit their physician, they should be in better health as well. So I love that, we can set our office apart and have a whole body focus. And I'm happy to see that we're seeing more offices kind of turning that direction and looking at the whole body. So, there's a variety of different things that I offer my patients, but I truly believe that Juice Plus has the biggest benefit of anything else I can offer them because it really affects the whole body and makes a huge difference. From a business perspective, again, I wasn't looking at this from, gosh, I need to have another business. I think most of us as professionals, we're busy enough. But I just felt, again, seeing the results, seeing the research, I felt the same way that many of the people on the call feel, that you just kind of have this obligation to at least offer it to people. They can take it or leave it, but we have a gift to offer people of better health, and we need to do that. So, it does allow me to create a little bit of extra income on top of what I'm already doing. And again, when I decide to retire and go that direction, it's good feeling to know that I'm going to have that to come in on the side and still be doing something that I'm passionate about and still being able to help others. So that's it for me. I'm going to go ahead and pass this over to Sara Kolb, who's an occupational therapist.
All right, so my story actually started a year ago, almost to this date. It was Thanksgiving break, and I had some great plans, except ended up sleeping 16 hours a day for 4 days straight. Ended up in the ER. And Donna, you kind of give me hope, because, and other stories out there too, because it is the sinus infections that get me every year. That's the only thing I get, being sick twice. And so ended up on 5 different antibiotics, 5 different steroids. It was kind of ridiculous how many medications I was on over the course of a couple months. So I am an occupational therapist at Children's here in Colorado, and Ellen Graham, who I was treating her young guys, and I had canceled several different appointments on my patients just because I didn't know whether I was coming or going, or if I was going to even continue to breathe. And the way that she tells the story is that I just look like death warmed over. And so she pulled out some capsules in her purse, and she's like, you just need to take these. And I was like, what are these? And so she told me they're fruits and vegetables in a capsule. And at that time, I was willing to try anything. Even went to essential oils, and I was diffusing oils. And so it was at that point that I was accumulating all these medical bills. And so I was like, well, I have no more hours in my day. What else can I do to make an extra income? And so while I was taking these, it just seemed like a no-brainer to me. Who can't use more fruits and vegetables in their day? And so I was like, well, this might be one way to pay some of these medical bills that I'm now accruing on top of student loan and mortgage debt. So that's kind of where the business aspect, I just jumped all on board with the whole thing. And so being an occupational therapist, is I've seen my journey continue, seeing a lot of kids who are picky eaters is the biggest one, right? I mean, them trying to eat other foods, but fruits and vegetables are always on the list that kids do not seem to want to eat if they are a picky eater. A couple different other patients that I've suggested Juice Plus, one with sleeping difficulties, with even medications in the middle of the night to try to get them to sleep. And I was like, have you ever heard of Juice Plus? Like, it's just worth a try, I thought, to the family. With these kids who use G tubes to get most of their nutrition, what they're getting is Pediasure. And so you can't help but think if they were able to get fruits and vegetables through the G tube, that could also help them health-wise and in a variety of different ways. The one patient who I know has started Juice Plus, he was a picky eater himself, and a couple other of suggestions that I made outside of Juice Plus have helped the family greatly. But once he started Juice Plus, and it wasn't even a matter of like 3 weeks, I don't think. Mom was saying his sleep improved. They just have a decreased anxiety overall at mealtime, knowing that their child is getting those fruits and vegetables through the gummies that their child is taking. She also mentioned that he has no more stomach issues. The last session that they came in, they stated that he was able to report that he felt like he was having an anxious stomach, and that was the first time that he ever been able to say what was bothering his stomach, which Mom was really impressed by. So that's kind of my story and the way that I'm sharing it and promoting my business. So I am going to now introduce Emily Smith-Nguyen, who is a chiropractor.
Hello there, everybody. And yes, I am Dr. Emily Smith-Nguyen. I'm a doctor of chiropractic and a chiropractic pediatric specialist. I decided when I was a kid that I wanted to be a chiropractor. I didn't realize then that it would mean 10 years of school and over $100,000 of student loan debt. But I love that I have the opportunity to help families feel their best every day. 17 years ago, when I started my own chiropractic business, it was just me. The more I worked, the more money I made. And so I worked all the time. Fast forward to now, and I'm married and I have 2 boys, and they are 10 and 7. I love what I do as a chiropractor, but I love my kids more. And so I would love to say that 10 years ago when I was introduced to Juice Plus, that I just got it right away and that it made sense as a way to stop trading my time for dollars. Unfortunately, though I joined the business and started Juice Plus, I really just shared Juice Plus when it was convenient. And it was only about 4 years ago that I finally got it. I had always carried vitamins and supplements in my office, but through the education that I have received as part of Juice Plus, I have learned the difference between isolated and how that is so much different than whole food. And so now Juice Plus is what I recommend to my patients and my family and my friends. As a family, we've had such amazing results using Juice Plus. My kids are healthy. They recover quickly if they are ever ill. For myself, between volunteering in the school and patients that are coming in, I am exposed to a lot of junk, but I rarely get ill. If we do happen to get ill, then we just get adjusted and take extra Juice Plus, and we get better in no time. It's also, Juice Plus has been a catalyst for so many different changes that we've made in how we live our lives, and we keep getting healthier as we get older, which I think should not be a crazy concept, but it is definitely not the way that everyone else is doing their lives. As I said earlier, I do love what I do, and I love being a chiropractor, but it is a tough job. We often work long days, we're on our feet with little to no breaks, listening to patients all day, as everyone else can probably relate. It's emotionally draining. And I also realize that I'm abusing my own body as I take care of other people. I have a constant battle with insurance companies to get paid for the care that I provide. And the free time that I have, I spend working on patient charts and all the behind the scene duties of running my own business. So with all this in mind, it's no surprise that sharing Juice Plus is a welcome reprieve. All I have to do is explain what Juice Plus, the product is, share my experience, and place the customer's order. The company ships the product directly to the customer, and before I would have all kinds of stuff that would be expiring on the shelves in my office. I don't have that problem anymore. And then the company collects the payments too. And people are much more consistent because they're not running out and having to come back in or not come back in to buy more. So it comes right to their door, makes it so much easier for them to be consistent. And my job is to follow up with great customer service. It's been to my experience that many people are grateful to have this as a simple solution for their family, because all of these families are bridging their nutritional gaps every day. I feel that through Juice Plus, I've been able to help more people than I ever would be able to with chiropractic. The business opportunity with Juice Plus, I too was not looking for that at all, but it has been very profitable for me as well. At this time, I am still working full-time as a chiropractor, but my Juice Plus income has allowed my husband to leave a job that he hated, and he, for the last few years, has been able to stay home with our kids instead of being somebody else to raise them. I look forward to even more time freedom in the future as my Juice Plus business income rises to meet my chiropractic business income, which it is. Prior to Juice Plus, something that I hadn't realized that I was lacking was a social life. I was a working mom, and that was pretty much all that I did. As part of this Juice Plus business, I have found some of my best friends. We're able to travel. We have so much fun together. And the Juice Plus product and business have been such a blessing in my life. And I'm excited to keep sharing this opportunity with others around. So thanks so much for having me on the call. And I will turn it over to Audra Thompson, who is a physical therapist.
Hello, everyone, and thanks, Emily. Thanks also, Reagan, for the opportunity to share this evening. As Emily said, my name is Audra Thompson. I am a physical therapist of almost 20 years. I can't believe that. And I own a small PT practice in both Oklahoma and Colorado. I opened my first private practice in 2006. And after learning about Juice Plus in 2012, I immediately incorporated it into my practice. And, why did I do that? Let's go into that. So several reasons, and a lot of those have been covered. However, one that made sense to me as a physical therapist is the issue of inflammation. Inflammation is a precursor to pain. Pain brings patients into my clinic, and they need help, right? They keep me in business. So I was noticing as a specialized physical therapist in manual medicine, in my private clinics, was seeing less and less restrictions that were, I think, related to inflammation. So as I was doing, Emily, I think you can probably relate to this, but as I was doing adjustments on my patients, because that's my primary mode of treatment, I was seeing quicker and quicker treatments, because I think that as they created that nutritional base, they were able to decrease their inflammatory load, decrease their pain, and I wasn't seeing restrictions that were related to inflammatory load. Instead, I was seeing other restrictions related to other things in their body. So it allowed me to get into their body deeper, allowed me to get into their body more comprehensively, and I think that was because I was changing their mindset about their nutrition, and their bodies were changing for the better. So it made sense to me right away because of that issue, but also, as everyone else has said, because of the extensive body of clinical research done on the products. This is an amazing thing that you don't see in any other product. The research alone is exciting to share because it proves that Juice Plus is consistent, it's safe, and its comprehensive effects on the body is truly second to no other product in the world. So that is why, in addition to exercise, right, I'm a PT, so don't forget to exercise, stay physically fit, but stay nutritionally fit with base nutrition. And I do that through Juice Plus. So I will always recommend it to my patients as an adjunct to a healthy lifestyle. So moving on to benefits. I'm just going to read you a few benefits that I noted because there are too many to count, right? And that's just in a 5-year period of time. So I have seen lowered cholesterol, improved HDL-LDL ratio, lowered triglycerides, improved heart arrhythmias, increased energy, increased mental clarity. And that is just from my own personal experience. That's partly my story. So other experiences reported to me by my patients include resolution of chronic skin conditions, reduced need of the dosage that they take on their rheumatoid arthritis medication. Had a couple of friends get pregnant after more than a year of severe difficulty conceiving. Of course, reduced joint and muscle pain post-exercise, which makes me very happy. Improved post-op wound healing. That is a big deal. And it was actually a patient who had an amputation. And the doctor had no clue why in the world they were healing this fast, because the patient was actually my 98-year-old grandmother. And he was astounded at how quickly in a 7-day period he was looking at her foot in the hospital saying, "What are you doing?" And she just looked over at me and winked. So I'm very proud of that. And then in addition, adding the Omega blend to the Orchard, Garden, and Vineyard routine, I am seeing that patients are noting improved memory. So that's a big deal too. So how did Juice Plus help my business? Well, I think that Juice Plus has definitely helped primarily because now I get to address my patients in a more holistic way. In addition to exercise, it empowers them to take hold of their nutritional health. It's easy, it's affordable. So I really love the diversity that Juice Plus has provided me, my family, my business, and my patients. On another note, Juice Plus has directly helped me stay in private practice. Because of the residual income that I get from my Juice Plus team and from my customer base, I can acquire an income that allows me to stay out of corporate America. I get to continue traveling to my businesses, both here in Oklahoma, also in Colorado. I get to dream about expanding that. I've also added 2 new clinics in the last month here in Oklahoma, and I'm looking to expand into Indiana. So I would not be able to do that without my Juice Plus paycheck, because there are times when sometimes insurance and productivity and all those things come down and they come crashing on you, and they're weighing on your shoulders, and you go, wow, maybe it's just easier for me to go back to corporate America and have a paycheck that is steady and just goes, every 2 weeks. But no, I get to see my paycheck grow, and it affords me the ability to live out my dreams and have the time freedom that I need to go ahead and continue seeing my patients and to serve the community in the way that I feel I was purposed. So it's been a huge blessing. So again, Reagan, thank you so much for the opportunity to share some thoughts. I want to wish everyone a happy Thanksgiving, and I'm going to turn it back over to you, Reagan.
All right. Well, thank you all. Oh my gosh, you ladies are amazing caretakers and making a huge difference in the lives of so many people. Thank you for being so forward thinking and for really making that connection between nutrition and disease in all of your different modalities. It's incredible to me. So, one thing I just want to add is that Juice Plus is simple. It's fruits and vegetables. It's a way to bridge the gap between what we should be eating and what we actually are. I think everybody that I have ever met needs to eat more fruits and vegetables. We all know that. So if you are intrigued at all, please get with the person who invited you to take a look at this and let them help you get started by adding this into your diet too. And again, I just want to say huge gratitude, a warm heart to all of you that were so willing to take time tonight and to share. So thanks everybody, and have a great rest of your evening.